In India,
Next question to you, Dr. Sandhu. What is that one biggest mistake we are doing with our oral dental care, which we are avoiding, or what is that biggest mistake we are doing with our dental care?
yeah, I think if I have to pick one thing that usually gets misinterpreted is that we are pre-programmed to think that we only need to go see the dentist when something is wrong.
Mm,
And that whole mindset that if it's not hurting, there's no need. Everything's okay. And that kind of backfires in a pretty big way in the long term. And one of the analogies I use is, let's say you get a brand new car, and like you got a beautiful new Audi, and there's a standard of care when you buy it. They tell you you need to bring it in for a wellness check every year, and you know it that this is what needs to be done. Right.
true.
So without thinking about it, you take the car back every year, and they plug in the diagnostic computer. They check everything's okay. They clean the oil. They clean the car for you. You take it home. Is that intimidating at all
Mm,
for you?
true. No, not at all.
Right? It's
Because,
relaxed.
because we are already programmed.
You program,
This
right?
is regular.
This is regular. Most companies will even give you the exact cost of how much the
Yeah.
appointments are. So there's no stress. You know, you're taking it in, you're going to drop it off in the morning, you're going to get it back. Everything's fine. The car's working fine. And that's how it kind of works, right? Now imagine that you don't take it, you use the same mindset with your pre-programmed dental mindset that let me just only, if it's nothing is wrong, why do I need to take it
Mm,
for servicing? And now you wait 2, 3 years, and suddenly there's that little rattling noise in the edge, and you're like, "Oh damn, I gotta take it, right?" Then you take it to the workshop, and they say, your transmission's broken, and this is
mm,
done, and they pull up the charges, and you look at it, and you're intimidated. You're like, "Damn!"
mm,
And then what do? You go find some cheap alternative, some
mm.
mechanic on the road, and say, "Please just try to fix it," and that just starts the downward spiral.
Yeah.
And that's the mentality that a lot of people have when they think about dentistry. That
Mm,
why even need to go if nothing
mm,
hurts?
mm,
When the reality is that if you were treating dentistry more like a wellness check, that every year I need to go get a cleaning done, get a diagnostic done, it's stress free. It eliminates all the chaos. It it prevents the
mm,
stuff from rapidly deteriorating to any situation where you need a lot of extensive care. So it saves you money down the line, it saves you anxiety, and you're much more healthy. So that mindset has to change over the long run.
Just recently I came across a picture on WhatsApp, and there was a person sitting and smiling, and he had one eyebrow. He didn't have one eyebrow,
Yeah.
and he had one tooth missing.
Yeah.
And it was a very comical situation, very hysterical, and people were asking, "What do you notice?"
Yeah.
People don't notice the eyebrow;
Correct.
they
Correct.
notice that missing tooth.
Correct.
So that is what we all need to understand, that smile and the face and how we, that is the first impact
Yes.
which we deliver.
Right. And your smile gives you confidence.
Oh yes.
And it reflects in your daily life, whether you're working, you're applying for a job, in your everyday life, even in your relationships. If you're confident about your smile, and you know that your smile looks good,
Mm,
people generally tend to like you more
mm.
compared to somebody who feels reserved, that they don't have good teeth, so they don't want to smile, and that becomes a part of your personality. And that's why we see so many of these transformative stories about people who, when they come in for a smile makeover, and all of a sudden now they have veneers or teeth that they want to show off. It completely changes their personality. If they want to go out more, they want to interact with people. So that aspect, I think,
Mm,
people ignore, and we kind of tend to put value towards luxury items like handbags and phones and all that other stuff, when the real value is investing in yourself.
True. I think suddenly, or probably in the last few years, this culture of investing in ourselves and not just being flashy, I think that is catching up, which is positive.
Yeah.
So probably let's start with your education background from India and to the US and your journey, how your education then transformed you to becoming a leading doctor and then coming back to India and starting a practice back again here. So let's have a quick
Yeah.
catch up.
So, I'm born and raised right here in Chandigarh. I did my schooling here in St. John's High School, went to DAV College, and then I worked my ass off to get into Christian Medical College in Ludhiana, and I finished dentistry here, and then moved on to the US for my master's. And then I went to UC San Francisco for my advanced dental degree, which is one of the top dental schools in the US. And I did a 1 year pediatric dentistry residency program as well. So, my experiences have been everywhere in dentistry, from research, training, policy making, policy implementation, and to the clinical aspect as well. So I've kind of covered the whole gamut. Um, and then, from the move back, life in the US is great. I've lived there for more than a decade in California, in Los Angeles, and in San Francisco. Um, but I think that the turning point was my mom was visiting us in the US, and she got diagnosed with advanced stage of breast cancer. And that moment kind of goes back, and it really hit me back at that moment, that what is really important, you know, uh, your family life, that is something that really resonated with me. And then it was just a perfect storm, I think, around that time. My wife, who's in finance, she was offered a leadership role here in India, and then COVID stuck, and then we decided, let's reconnect back to our roots. Let's set something up in Chandigarh, and kind of see how it goes and be closer to family as well.
So that was your entire turning point, which got you back to India.
Yeah.
But then, while you came back to India, obviously you are here because you wanted to, you know, enjoy a great, family companionship. However, side by side, your professional practice also needed to be established,
Yeah.
right?
Yeah.
So if you can take us through that, how easy, difficult, or uh,
Yeah, it's a sea change. And I'll, kind of backtrack from my story to kind of sort of the broader picture first. I think dental education in India, when you compare with US and the Western world, there's a big gap. In India, the education is valued more towards the theoretical part of things, and the emphasis is on clearing exams rather than on the practical aspect. Um, I like to think of it in a way that learning dentistry in India is learning how to swim watching a YouTube tutorial, that you watch it and you nail down the theory, and you know the strokes and you know the muscle groups that are involved, but you've never been in the pool, right? Whereas compared to the US, they have a much more robust structure in place, that even before you get into dental school, you have to go through a series of progression where, it's not just about you being the best test taker on a random day that defines your career path. It's about your personal story, your personal essays. It's also about your extracurricular activities, um, and the interviews. And there's various steps that you go through where you determine whether this is the right career path, and then the school also determines whether you are the right fit for that. So that kind of makes things a little more harmonious when you reach that level, rather than you just taking a random test, and just because you scored better, you are supposedly a better suited person to go in this line of work. And once that education part is done, I think the another big difference is that in US, dental schools are more practically oriented. So very early on in your career in dentistry, you are kind of thrown in the pool right away. So you are patient facing, You learn the importance of communication with your patients, the importance of being efficient and following the rules and regulations and the compliance and all that stuff, and which makes you a better all-round dentist. And I think the biggest thing is that you're more confident when you're done because you have a body of work that goes through compared to graduates from Indian dental schools where they are kind of like lost, and they don't even have the basic entrepreneurial skills to kind of, navigate their way through the landscapes. And that is one of the reasons why so many of the graduates, they look for greener pastures abroad, because they feel that there's lacking in the education system. And there's a big infrastructure uh, aspect of things as well, where schools don't expose you to the newest evidence-based dentistry techniques, the skills you need to use some of the modern equipment that's lacking. So, uh, there's a big change that needs to happen over the years to bring our standard of care up, uh, from the students, which will translate it into future dentists and then their practices, and then filters on to people who are seeking dental care as well.
In your opinion, have you seen any shift in the quality of education and exposure in India, not particularly to dental, but otherwise?
Yes. So, and I can only relate to my experience, which was when I graduated, a couple of decades ago, where when we graduated, there were no extracurricular courses that you could take, no curriculum outside of dental school. It was hard to find mentors who would take you under their wing. But now that landscape is changing. And especially around COVID time, when there was this emphasis of stay at home education,
Mm-hmm.
a lot of the dental education companies around the world uh, kind of decided that, let's not have everything workshop based where people come in and then we teach them how to do something. Maybe it has to be a little more uh, uh, online education. And during that time, I think a lot of Indian dentists who are experts in their field have gone to that same platform where now they are holding classes. So whatever uh, line of dentistry that you are interested in, whether it's implants, oral surgery, restorative, or cosmetic, you can find mentors and then you can take their courses, or there's a path to it, which is now becoming increasingly coming to the forefront than it used to be back then. So you can, India is an emerging market in terms of that, but then the thought process still needs to change on how we treat patients. It's not just about setting up a fancy clinic and with a fancy equipment that does the work. Has your mind evolved with the your environment as well?
So your education, your training, and your fellowship in the US definitely gives you an advantage because of all the practical experiences. And so, how does that translate into building a practice in India?
So the my goal always was that I wanted to start my own dental practice. And in the US, it does take a long while to go down that road because you got to work as an associate, and building a practice in the US involves a lot of other logistical issues that you kind of have to deal with. India is much easier that way. You can be up and running in a fairly a quicker amount of time, and lesser capital is involved as well. Um, but my whole concept about setting up a practice was based on my experiences, and this is uh, the sum of all of my education experiences throughout the US and in India. The one thing that I realized was, how do we make dentistry less intimidating?
Mm,
Okay. And w- the things we need to do to lessen that anxiety, lessen that fear, you know, m- bridge that gap between patient care and doctors and how approachable they are, that has to be the key.
mm,
It wasn't set out that, oh, I need to make the fanciest practice or have the best tools. The focus has always been, how do we make it less intimidating? And then that translates into, all right, so if we're going to design this practice, how do we build the interiors so that they're more relaxing, more calming? the technology we're using. It's not just that this technology is fancy or the newest thing. How does it really translate into a patient experience? Does it make their visit easier? Does it make my job easier? And then the third thing is having the right people around you. Your staff is the best investment you make. The time you put into training them, and the way they interact with your patients, that is a kind of a culmination of the right key ingredients you need. So the focus always was, let's get let's get something up and running with these kind of core values. Make it comfortable, make it less intimidating, and then let's focus on building relationships with patients where a doctor is not just somebody with a white coat who sits behind in a closed room, who's not approachable, and you feel intimidated every time you speak with. It should be somebody, if you're trusting them with your health, they should be accessible to you. You need to be able to be comfortable telling your story so that we can be on a journey together to make sure that, because dental health is not a one-off thing. It's not you fell down those stairs and you broke your shoulder and you went to the doctor and fixed it and you'll never see him again. The dentist is an ongoing relationship. So you need to have somebody who's reliable, who's trustworthy, and you has a track record of getting you out of trouble whenever if that situation kind of arose. So that was kind of the core values that we focused on. And in terms of, you know, logistically putting that into uh, implementing that, it was much harder.
True. I get it.
Because I was used to working with certain types of equipment. There's rules, regulations, and protocols that we follow, and it was easy enough to get the interiors and all that done. That stuff was easy, but the equipment part was the first biggest hurdle that we faced. Uh, and India has a lot of import challenges, as we all know, with this whole tariff situation. That
Especially
it,
now.
especially now, and just in general, like medical devices, the government is not
Friendly. Yeah.
subsidizing, import of these technologies. There's a big markup on these things, so it's not easy to get that stuff in. So what you see most of the time is subpar Chinese goods that are flooded the Indian market when it comes to dentistry equipment, which are not FDA approved. Nobody knows whether they actually work or not. Um, and it actually harms the patients more than it does any good. So navigating that whole landscape where I had to put my foot down on certain things where, things that are important, there's no compromises on the things that I'm going to use and work with every day, whether it's having a comfortable dental chair, having digital scanners, which is not just a fancy gadget that we have. It shortens the appointments. Uh, there's no more of that hooey impressions that you take every time you need to get a crown or get dentures or anything like that. Um, and it's more comfortable for the patient. So there's real value in that stuff. And now we're moving to the digital age, which means that once we scan these things, they go into a computer, get worked on Exocad, where we can actually see predictable results on what the final outcomes, which translates into more accurate results. We are able to deliver the thing that we promised, and so there's a win-win for everyone. So investing in those technologies, getting all that infrastructure set up was a hurdle. It was kind of assembling, an IKEA piece of furniture without instructions. So you get everything together, and then you got to figure all that stuff out. And I have to wear many different hats within the clinic. It's not just being a clinician, but being a technician to kind of understand the equipment, being an entrepreneur at the same time, building the business. So it is a lot to take on. In the US, you can outsource a lot of these things, and there are companies who manage the whole practice for you. That is not so prevalent in India. You kind of everything kind of falls on you. And I don't mind doing all of that. I think that's a little bit of my personality as well. That I'm a little bit OCD and micromanaging all these things because I want to know eventually what's going on in every single part of the process. So it's been a fun ride. Um, there are challenges, but it's you just got to stick to your guns and
True.
and just weather the storm initially, and then you come out on the other side.
True. While initially we were discussing that dental care is preventive care,
Yeah.
that and that mindset is not extremely prevalent in India,
Yeah.
especially. So your audience already gets shrunk,
Yeah.
right? And then you establish a new business. So there are two kinds of people who do not believe in preventive care. So they will only come when there's an issue.
Yeah.
And there are people who, okay, they somehow believe in regular checkups, but they already have somebody uh, as their
Established care.
established doctor
Yeah.
who they would want to go back to.
Yeah.
Because I think there is a certain comfort
Yeah.
which needs to be established
Right.
between both
Yeah.
the doctor and the patient. So how was your journey to breaking into that and positioning yourself as also a high tech clinic with all the latest equipment, which, as you mentioned, shortens and gives you a more accurate result, and plus establishing that comfort while being uh, decently not extremely competitive with what the other people would charge. So there is a certain luxury statement and comfort which you deliver when people come to your clinic.
Yeah.
So how easy, difficult was that to embed that seed into the mindsets and getting your clients on board?
Yeah. So there's different ways to look at it. I kind of simplify things. I would say that the biggest difference in our clinic, or if you compare with anything else, is that my mentality is that I don't fix teeth. I work with my patients. I see beyond the teeth. I work. I try to understand you, your factors that are influencing your oral health, and I try to guide you on that journey together, where we are both partners in invested in your betterment of your health, and we have our clear goals that this is where we want to go. And one of the key things, aspects of this whole thing, is just actively listening.
Mm.
And I think that is very rare
Mm.
in today's kind of fast-paced world. And we've all been there, where we've gone to any medical doctors or dentists, and you just see them for that 5 minutes.
Mm.
Then you sit down and they say, "Gee, what's the issue?" And you tell them, and then they tell you you need a root canal, and that's it. And that's the end of that conversation. There's no talk about how did this happen, what could be some of the factors that led to this, how can we prevent this happening. So the real value add is not just fixing what the issue is,
Mm.
but educating your patients as to why the reason that they came in has happened in the first place, and how do we prevent this moving forward. And
Mm.
is this aligned with the goals that you have for yourself?
Mm.
Because I also cannot be judgmental and think that every patient who wants to come into my practice wants like a Hollywood smile and be perfect at the same time. Your goals and my goals could be completely different. True. You just want healthy teeth.
Mm.
Or your conception could be that, everybody loses teeth, and by the time I'm 60, I'm going to lose all my teeth. So why go jump through all these hoops? I'm okay with getting. So that needs to be aligned. So I think the listening part,
Mm.
I spend more time in my initial consultation just sitting and just learning more about patients and developing that relationship,
Mm.
where I try to understand what are the set of circumstances that put them in that chair in front of me today. How can we improve that? How we are definitely going to fix it, but how do we improve this moving forward?
Mm.
And I think that interaction, that authentic interaction, and I'm not. It's there's you can fake
Mm.
conversations, and a lot of time I'm sure you've also seen,
Mm.
you go out and you talk, and
Mm.
there's an interaction with an intent,
Mm.
the short talk. But
Mm.
when it's actual, you know
Mm.
uninhibited, kind of speak from
Mm.
your heart, what's going on, how
Mm.
do we fix it, this is what it's going to take,
Mm.
are you ready to accept the challenges, and then we go on a journey together.
No, I think I completely relate to that because, when I visited your clinic, I love two things about it. One, you have noticed that at any given point of time, there'll be only one patient.
Yeah.
So there'll be no patient waiting.
Yeah.
So that clears the atmosphere for any person who's consulting you to open up.
Yeah.
Right. Because people like us, we don't want to see others,
Yeah.
knowing us or,
Correct.
getting a consultation.
Yeah.
So we want to keep that under wraps.
Right.
That is how, mindset is.
Correct.
So that comfort level to open up starts.
Yeah.
And plus the entire ambience and setting and the equipment, that, levels us so much that we understand that there is so much comfortable in, explaining the root cause of the story
Yeah.
so that, more accurate, definitive treatment can be the outcome.
Right.
So I think these two, you have nailed them very well.
Yeah, and it all goes back to how do we make it less intimidating, right?
Yeah, yeah.
If I have 5 people waiting in the waiting room and
Right.
you walk in,
Yeah.
it's not just the pressure on you,
Yeah.
it's the pressure on me, which I don't want to have. I want to be invested in every single patient who walks in. I want to give them my time. They're paying for my time, and I will give them my time and my undivided attention. I'm not going to take phone calls. I'm not going to be distracted. I'm here. I'm listening. Let's figure this out. Let's move ahead. And you create that relationship. That's the real value in a long term, building a successful practice as well. You know, it's not about any fancy gadgets. And I'm sure even if there were no fancy gadgets in my clinic, my mindset would still be the same.
True.
And we have to kind of, you know, figure out that medium. And when it comes to stuff like budgeting and, not everybody has the same paying potential. And we realize it. I'm not ambiguous to those challenges. We've all been there. I've been a student. I've been in a position where financially you are not there yet. And, dental health might not be the most important thing that you're going through in your life. But we figured it out. There are options. There may be more budget friendly options, more things that we can do. Some things we can put on the back burner, take care of later, things that need to be fixed now, let's focus on that. But those things can be navigated. But dentistry is not expensive. Neglect is more expensive. So neglecting the issues, something that could have been fixed with a simple filling done at a routine checkup, if you ignore it and then you go a couple of years later, turns into a root canal, which costs now 2-3 times more than the filling. Then you need a crown on that root canal, which is another 3-4 times the cost of the filling. And guess what? Root canal and crowns are not going to last you as long as a normal tooth would have with a filling. So a few years down the line, it needs to be extracted. Now you need an implant. So you see how those X's multiply over time. So things that could have been fixed early on have now amplified and multiplied into these, and that's when the intimidation, and that's when people say, oh man, dentistry is expensive, or this dentist is expensive. So what is the real value? The real value is preventing these things before, or catching these things and making your patients aware of what's happening in their mouth. That is the real value add, I feel, and that needs to be captured more.
Do you feel there is a difference between the patients who would have come and consulted you in US and now what you see here in Chandigarh?
Yes and no. I think people more or less are kind of the same wherever you go. Um, but it's just that their experiences in the US, it is um, part of their routine that they need to go for a dental checkup once a year. And what dictates that is insurance policies and all that stuff. So people that have insurance, well, they go for a regular checkup. Otherwise, it goes wasted, and then you know. It's the that kind of structure plays into their mindset that yes, I need to go, and they're more aware of what's happening. They don't wait for things to cascade in a down spiral before they go to the dentist. In India, it is oftentimes that mindset is based on anxiety, based on prior experiences with the dentist. Trauma from dental visits is the number one reason why people don't want to go. And I hear it time and time again where patients come in and they said, you know, there's a little, the intake form we have, I always ask them, what is your anxiety level right now? How fearful are you of the dentist? And every time somebody marks like very anxious or on the higher scale, that's the first question I ask them. Tell me what happened. And then they'll relate their experience. I went here and then, this happened and this dentist, he didn't tell me he was going to do this. And then this happened and blah, blah, blah. And I'm so scared. I don't trust the process. So you know, you have to kind of navigate through those channels because the consequences in India for negligence aren't the same as in the US. So it is a little bit burden on our profession as well. Sometimes we don't take the time to explain to patient what's going on and kind of help them understand the situation. And patients often feel that there's a disconnect, and that once you lose trust, it's very hard to regain. And that kind of translates into people not wanting to go to the dentist or ignoring issues because God knows what's going to happen. You know, and the the mindset I think when it comes to kids is a much more deeply rooted in the Indian audience. Though. I think in the West, you go, you take your child, your infant for their vaccinations. You see the pediatrician, and the pediatricians have very clear guidelines that at age 1 they will advise you to go see the dentist. So you've got your vaccinations. Now the next step is you need to go get a checkup. And it's not so much that the kid is going to have dental issues at age 1, but it's sort of more educational for the parents to be there to understand what are the things they can do now to prevent any issues in their kids' oral health moving forward. Because the biggest misconception is that, kids have baby teeth and they're going to fall off anyway. So, let's not worry about this stuff. And trust me, the one thing, if there's a poster I can put outside my clinic, is that patients, parents are absolutely in tears when their kids have dental issues, and these baby teeth, they're not easy to fix. Once you've gone down that road where the teeth are getting bad and nothing is being done about it, and there's oral health is being neglected at home, it's very hard to change that. And that mindset, then that light bulb kind of goes off when they come in and say, "Oh, I didn't know this. Oh, I wish somebody had told me. I wish I'd come to you earlier." Because now they have a kid who's sitting in the chair, anxious, crying, screaming, because he's got a toothache, and I got to figure out how I got to numb that tooth before I do any kind of treatment on that tooth. And the patient and the parents are just they're crying more than the kids in a way, and they wish at that time that if somebody had told us that we need to go see a dentist before.
I think one thing is very commonly I've understood here कि लोगों को लगता है कि ये तो मिल्क टीथ है
Yeah, yeah,
तो खराब भी हो गया तो क्या हुआ
yeah, yeah,
दूसरे तो आने ही है
yeah,
तो खराब कर लो
yeah,
so I'm sure
yeah,
I'm 100% sure you get to these parents more often.
yeah.
What are the other few irritating you know
No, nothing is irritating. I think I've seen heard the whole gamut, right from you know I mean, you can't blame the I try to understand the environment around the patients. The parents, especially if they have like a 5-year-old, and the mom also has like a year and a half old toddler, and she's barely keeping her sanity, getting those two kids to kind of raise them, and they get cavities and all the stuff, and then that's one more additional burden on her.
Mm.
And then they kind of sometimes will try to put a blanket on it and say, "Oh, no, 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 he brushes. It's totally fine." I think, I also had bad teeth run in our family or something like that. And, that's a conception. It's genetics. And there's absolutely nothing to back that up. And, I will sometimes sarcastically just point out that bad genes don't run in your family, bad oral habits do. Habits. Yeah.
Yeah.
But it is in a way that it relays the message to them that let's not play the blame game. There are things you
Can get
could
rid
have done, but there's still things that we could do. And when it comes to baby teeth, there's so many of these longitudinal studies that have been done over the years in decades and decades where they followed the oral health of kids right from age 1 till the time they're 30. And the kids who had better oral habits when they were kids translate to better outcomes when they're older. Because even though they're baby teeth, your habits are not suddenly going to change once you get your adult teeth. It's not like, oh, it's baby teeth, so I don't need to brush them twice a day. But when I get my adult teeth, I'm going to switch to like brushing twice a day. It doesn't happen. Like that.
doesn't happen. True.
So you have to create that environment early on and put them on that upwards trajectory right from day one. When that kid picks up, get them brushing, let them get the feel of what it feels to brush their teeth. Bring them into the dentist. The kid's first visit to the dentist doesn't have to be when they're in pain. Not just for them, it's traumatizing for me as well. Imagine, trying to help a kid who's screaming and in pain and won't open their mouth. But imagine that kid had been coming to me for their general checkups, and we've done their cleanings and fluoride applications, and then they already know me, and there's a comfortable environment that they trust. And then if they have an issue, they won't be so much more intimidated to kind of open up and let me do my thing. So, all these things, they're small things, but when you put the whole piece of the puzzle together, they really, really help. So, getting the kids early is one of the key things that we tell parents, and especially young parents.
Coming to the digital part of establishing a business in India, yes, it takes certain time for you to spread the word across, and it is a two-sided sword. We have social media as a tool where you can target a larger audience and relay your message. So how was that journey? Because it takes time to establish a practice. Takes time.
Yeah.
And this is my last question on this podcast,
Yeah.
because as a doctor, you're also an entrepreneur.
Yeah.
And your inputs in guiding anybody who wants to enter probably into the preventive wellness industry would be impactful. Not just dental care, but any industry where, coming back from US or any other country, establishing a high quality practice and delivering quality, practice to people. How difficult or easy would have your journey be?
So the running the practice part, I think, wasn't that hard, to be honest. I think it came a little bit naturally to me. I am, anyways, always been relaxed. I don't get too wind up about things. And even when I'm doing dentistry, the clinical protocols and everything I follow helps me sleep better at night, knowing that I'm following the standard of care, I'm using the best equipment. So there's no uh, mental pressure on that. But yes, there are things that wind you up, especially when it comes to promoting your business and dealing with all of that stuff. I think that is a very real challenge. Um, and sometimes, it is the generalized mindset is that, oh, you need to have your social media presence and just keep posting something, and eventually you'll get some followers, and then things will start trickle down. But I've always believed that I don't, just the same way that I practice dentistry, I want those same values to be even carried forward to every aspect of my clinic and practice when it comes to social interactions and social facing pages from my website, to be curated to only give out information that's pertinent. Our social media platform on Instagram, we're not on Facebook, but Instagram, most of our content is based around dispelling myths around dental and helping them being more educational rather than being advertising the clinic. Because we want to create value in everything we put out. And sometimes that approach, uh, it comes from my core values, but it might not be the best one when it comes to actually social media reach and all that, because you need to be posting every day and you need to be doing all of that. So those challenges were still, they are very real. And I think you just have to figure your way around that whole landscape. But I think at the end of the day, you just have to be yourself. You know, be real with your patient, be real with the stuff you put out, because how you do one thing is how you do everything. So that mindset really translates into your environment and the people you interact with.
That is very critical, because I think I've seen your pages, and I've understood the content which depicts the quality care, which but somehow somewhere I also feel that as a professional, that we have to side by side also think of content creation.
Yeah.
So it is challenging at some
Yeah.
point of time.
Yeah. And, it's inspiring for me to see you doing a podcast because I've known you for a while.
Yeah.
And then, I've seen your journey through My Soho and all that. And then, you've taken that additional interest
Right.
in like
Yeah.
taking up the challenge to do it.
Right.
And it's inspiring me
Oh, thank you.
as well.
Thank
So hopefully this is also one of the things that's on my sort of checklist that uh, doing maybe not podcasts, but maybe YouTube educational content,
True.
which then you can use in various platforms.
Right. And we seldom know how impactful they can be.
Oh yeah.
So I think the idea is to keep going, keep doing, and keep innovating.
Yeah.
And on that note, I would thank you, Dr. Saab,
Thank
coming
you. The pleasure is all mine. Pleasure is
and
all mine.
sharing your inputs
Yeah.
on this podcast.
This was wonderful.
Thank you.
Yeah.